Good morning, everyone, and thank you very much, Richard. I would like to begin my remarks as well and to thanks to the Coast Salish peoples whose traditional territory that we are gathered and meeting this morning, as well to pay my respects and gratitude for the opening remarks and prayers. I think it's important to be able to start the day with those kinds of remarks to allow us to clear our minds and clear our hearts so that we can come together in this way. And I'm very pleased and delighted to be able to join you at your third annual gathering of Wisdom Forum. I think it's so important that when you gather in this way, you come forward with an opportunity to hear what has taken place in the past year and then find even more ways to move forward. I want to offer my good morning, my greetings to the co-chairs of the First Nations Health Council, of course, Chief Lita Wheatsum and Councillor Debbie Abbott, the co-chairs of the First Nations Interim Health Governance Committee, of course, Grand Chief Doug Kelly, Grand Chief John, and Chief Shane Gottfriedson. And I know that the Federal Health Minister, the Honourable Leona Gluckert, will be here this afternoon. I'm afraid I'm going to have to miss her. I guess our planes will be passing through. But I know she is very keen on being here this afternoon with you. I'd also like to acknowledge and say my gratitude to all the First Nations representatives here, the chiefs, the health directors, the councillors, the community members from the 203 First Nations in British Columbia. Your presence here, by your own presence or being a representative, again shows a true commitment and desire to look for solutions and to move forward. And of course, you will see that we have federal representatives here, provincial representatives here, people from the health authority here as well. For me, it's been just over a month since I last had the opportunity to meet with the principals of British Columbia's tripartite First Nations health plan. And at that meeting, there was a firm commitment by all tripartite agreements in working towards and seeking an agreement in principle by the end of this year, knowing that there was much work to do, knowing that we wanted to hear from everyone, knowing that input was critical from everyone. But I know even since that month since we have met, much work has been accomplished, and I want to recognize the work of all the tripartite partners in that process. The undertaking, the task is by no means small, and there has been much progress and there has been dedication towards that. Because I know we all want to see the tripartite plan's goal of creating a new governance structure for First Nations health in this province achieved. It will be a landmark. It will be a milestone that other provinces, other jurisdictions can look to. And I know that we are all committed to reach agreement on the governance transfer from Health Canada's BC branch of First Nations and Inuit Health to a First Nations Health Authority. Though this is a transfer from Health Canada to First Nations in British Columbia, the province recognizes its role as a partner in this process. It's about changing how decisions are made, and that is an important part in changing how health services are provided. It's about moving control of First Nations and Inuit Health to a First Nations Health Authority. And that's an important step in all our efforts to improve how decisions are made about First Nations health. Another important step is in changing how decisions are made within provincial health authorities. This is why the province is very interested in the potential opportunities for better coordination between on and off reserve health services. I see this as a major opportunity for all of us. And as I've pledged to others that I've spoken to, I've pledged that I will continue to commit the time and resources of my senior staff and wherever I can attend as well to make that a reality. So I am, and I want you to know personally, committed to doing whatever I can as BC's Minister of Healthy Living and Sport to ensure that we're able to reach such an agreement. And I firmly believe it would be another valuable tool in our work to eliminate the health gaps between First Nations and other British Columbians. And we all know there are gaps, and we all know that it's time to close those gaps. I want to give you an example of some success we though have achieved, and that is in dealing with something that I know is very relevant to all of us today, and that is H1N1. Tripartite partners are working effectively together to coordinate and communicate to communities about H1N1. Our level of response and coordinated planning has been possible thanks, very much thanks, to the work of First Nations leaders and the relationships developed through the tripartite plan. And so a new governance model will streamline the delivery of services and ensure that culturally appropriate health care and prevention programs and policies are undertaken and delivered to First Nation citizens in British Columbia. So I believe we've seen success already in that delivery of the H1N1 plan. And if we can build on that kind of collaboration and coordination and commitment of working together, I can see even more success as we move forward. But we also remain very conscious of the spirit behind the tripartite plan, and we know such a governance structure won't be a success unless each of the parties is comfortable with the terms of the agreement in principle, and that's where all of you will play a key role. We do want to ensure that everyone can feel that level of comfort, because we recognize that it is important for all of us to take advantage of the significant opportunity to improve First Nations health provided by the tripartite plan. And it's also important that we continue to strongly support our partners as we work out the details of this agreement. So that's why I'm here today. That's why I am reiterating British Columbia's commitment today and pledging our continued partnership to BC First Nations leaders and the federal government in these efforts to improve First Nations control over how decisions are made about their health. And with the continued strong work of our First Nations chiefs and leaders and their continued partnership with our federal and provincial governments, I'm absolutely confident that we're moving in the right direction. So once again, I know there's much work to be done. We have some wonderful panel experts to give you an overview of what has been done today and an opportunity for you to network over the next number of days. So I'm delighted to be here with all of you today. There's much work to be done. We're working towards a common and extremely important goal, and I'm looking forward to the results of what happens after these next few days. So I wish you well in your discussions. I believe, as was said in the opening prayer and remarks, we clear our minds and clear our hearts. We will achieve great things today. So thank you all for being here, and thank you for allowing me to address you this morning. Thank you.